Community Board 6 Health and Human Services Committee. My name is LV Barroso, and I'm the chair of the committee. This meeting is called to order at 6:37 p.m. Tonight, we are joined by Assistant District Manager Brendan Burt. Members of the public, you can raise any questions or comments that you have through the Q&A feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Marty is taking minutes tonight. Thank you so much, Marty. We appreciate you volunteering the last minute. So we will now take the attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name and you will unmute yourselves. When your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Present.
LV Barroso.
Present.
Dan Devine.
Present.
Rich Vince. Raj Nayar. Anju Suresh.
Present.
Ronnie White. And Sandra Leftoff.
Present.
We have a quorum.
The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no objections, the agenda for tonight's meeting is adopted. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members, if you have a question about committee business or wish to make a motion, please raise your hand through Zoom. The chat function should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. We are required by New York state law to create a verbatim transcript of the meeting. So please keep your questions and comments succinct and germane to the discussion. Tonight's agenda, the first one is the presentation on A6058/S5474, legislation that would establish a single-payer health insurance system for New York State residents. So Andrew will give us a summary of this legislation.
Thank you, LV. So I will give a high-level summary of the legislation, and I will recommend at the end, if we're interested, that we table this discussion when we have representatives from the Campaign for New York Health to be able to discuss some more of like the mechanics and the specifics and open that up to discussion to the general public. So these two bills, the Assembly and the Senate bill, They were put together to establish universal guaranteed healthcare. It was actually introduced kind of during the brunt of the pandemic as part of the Compassionate New York campaign, as a highlight of how like COVID-19 has just exacerbated some of the already existing inequities in our society, and further like emphasizing the need for comprehensive health coverage during this time. So what the Act calls for is universal coverage for everyone who works full-time or lives in New York, regardless of immigration or employment status. This includes like comprehensive benefits such as medical, prescription, vision, dental, hearing, long-term care, mental health and substance use disorder services, reproductive care. And the way that it's financed is actually through it's well through taxation, but it's through a more progressive tax system. So that's kind of the high level of what this bill looks to establish. There was it was a hot topic during the legislative session this past spring. So that's how it came to mind as being a potential discussion topic for us, because it is anticipated that this bill will be reintroduced for the next session. So I figured it'd be a good opportunity, because this would affect like everyone within our jurisdiction. And it is like it's a pretty like hefty bill with like, again, gets into like some more of the technical details of how like funding works for these clinics that would service those who are currently uninsured. So I figured it'd be a good opportunity to have like a bit of an education session on what this bill really entails, and kind of like what the prospects would be for its ratification next year, potentially. Some of the challenges as well as some of the opportunities here. Yeah, so this, and the way that we ended up talking about this, Albie and I were brainstorming what really we want to focus on as a committee. The topic of health coverage largely has always been, I think, like a hot topic, a hot issue, and especially pronounced now during a pandemic. So that's how I came to suggest this idea, especially because there has been a lot of, again, publicity over it. So that's kind of where we came to talking about this as a discussion point. More, I think it would be a good education session, as well as if we felt strongly one way or the other after we had like done research, further research, and like ask questions to representatives from this campaign, then we can maybe decide if we wanted to do something from there, either assisting in the, I don't know how political we can get as community board because we're nonpartisan, but either like assisting in like the phone banks or the resolution, showing community support for these kind of bills does make a difference. So I figured it'd be a good way to put a stance on the ground. But yeah, long story short, I don't know if anyone has any thoughts, questions, comments, or feedback on that, or if there's anything. I was going to say we can talk about this in old and new business, if there's anything else you'd want to like discuss as well, rather than this bill. But yeah, open the floor.
I don't know how to make the hand. Oh, I see the hand. Okay. Do I just speak,
Yeah.
or?
Yes.
Yeah. One was just a question about the bill itself. Is that who is it like a state-based Medicare? I mean, what's the structure? Just is that the idea? It's the state funds it, and then it basically works like Medicare, or is it privately run, or is it public?
Publicly, and yeah, it would work like Medicare. Yeah, so it'd be state funded. I mean, and that's like where it kind of gets complicated, where it's just like it's weird to think that New York State by itself would have its own like single payer system versus the entire country. I'm sure there's like inefficiencies there, but yeah, it would be a public insurance.
Okay, and I guess the second one, and I'm not sure where the how this works, but the question would be, in a way, it's about the structure and function of the committee. Since this is obviously a very large large political issue, and this is a community board. So, how do you decide on the agenda? Does the committee deal with state-based issues, local? I had assumed local. This is a state-based issue. I understand that it affects everyone. And I'll give you a little bit more on that. But so that's, my question about how is the agenda, because I realize there's a second agenda item as well. How does that work here in this committee?
Can I respond or?
Hmm?
Can I respond or is it, I don't know, the
Oh,
Robert's rules? Oh.
yeah, you can respond if you.
Yeah, I was gonna say, so if there are specific like local issues that we want to focus on, I also would be more inclined to hone in on those. I mean, this is something that would like affect our those within our community board, which is why it's still very much relevant. But as you've noted, but if there are particular local issues, I'm more than happy and willing. I think we should be able to discuss those as well. This is just something that has come to mind.
Right. Partly the reason I raise it is I'm a retired city employee, and one of the changes that has come about, it's quite a big one for all the retired city employees and municipal workers, is the change from the attempted change for us from public Medicare coverage to private. It's one that's very important on a city-based level and within our own community. So that's when when I saw that about the state, I thought, wow, we have been so struggling locally to deal with this. That seems to me it's a very important community-based issue. So that was, how I got to wait. How does this get decided about what should be on the agenda? So just so I can figure out how this committee works. Yeah.
I think, Sandra, you're raising a very good point. And I think that question of yours can be answered when we have a speaker from the one that Andrew is looking forward to speak on us. And I think that question can be addressed probably in our next meeting.
I'm not sure I understand. It's not a state-based issue. It's a city-based issue, actually.
Yeah.
Yeah.
Your
Okay.
question is more detailed, which probably can be answered by a person that knows more about these legislation and has expertise to answer your questions. So we can save that question for the next meeting.
Okay, that's fine.
I see Marty has his hand raised.
Marty?
Yeah. About what, well, the agenda is generally made up by the chair, and it's things that have caught the chair's eye or the attention of individuals on the committee. In general, and with our budget priorities, we focus on things that would be for our community, but there are issues that are broader. Like for instance, for over 20 years, we had on our budget priorities the completion of the third water tunnel, which was coming from the reservoir upstate right through Manhattan and being connected in the various parts of the city. As you may have seen over the years, long stretches of the city was broken up for laying the new pipes. That isn't local and community board focused, but it's something that really affected us all. In transportation, they've been backing the full build of the Second Avenue subway pretty much since the beginning of community boards. And while that isn't necessarily going to help us in the near term, as it's cut off at 63rd Street, again, it's something that we've been actively trying to make happen. So This health bill, which has been kicking around since the 2015, 2016 legislative year, obviously it was having things that many of the senators and assembly people couldn't really deal with, but there are so many that are signed on to it now. It'd be a good thing to learn what's in it because it's going to become law. It looks, after these many years, there's everybody's idea of what should or shouldn't be in it probably has happened.
Yeah, I agree.
And as far as being a city employee, I'm married to a retired state employee, and even when she was working, they had given the proclamation that when you turn 65, Medicare is your primary, and the state plan is your secondary. And I thought the city operated on the same way.
Yes.
So whatever the state does with this, Medicare would still be the primary.
Oh my God, I can't go into it now,
Okay.
but it's, they undid something that was so upsetting. They're actually trying to, they're trying to put all of us on a Medicare Advantage program. And it was really done behind closed doors. It's actually quite disgraceful. So
it might be
shocking.
something for this committee to discuss.
I think it is really, because it affects, well, right now it's 250,000.
Well, right now it's not germane. If you want to bring it up in new business or put it on the agenda for December, you know.
Yeah.
Yes. Then let me just ask one other question: is how do we communicate as a committee? Like if something comes up, how do we communicate? Or there's something I think, oh, it would be interesting for everyone to read, you know, that how do we communicate with each other? Do we as a,
send it to Brendan and Brendan would distribute it.
Okay, thank you.
I'm sorry for interrupting.
No, I appreciate your description. I really, it was very, very helpful.
Any other questions?
See that Dan has his hand raised.
Okay. Dan.
Thanks. Yeah, and I think it would be great to have some, have a speaker talk about this. One, I know a little bit. I remember, you know, Representative Gottfried came and discussed it in the past, and I think he's proposed. This has been proposed every year since 1992. So, you know, for us to know more about it, and perhaps maybe the political winds are changing a little bit, would be helpful. But, you know, it has been proposed for basically 20 years. But another question is, but I'd love to learn more about it. And I definitely actually want to read the bill because I think it's pretty interesting. But something that I did have just more towards kind of some of Sandra's more, you know, some of her questions is, this is obviously a huge issue that affects everybody who lives in New York. But from what I've seen in my years on the community board, I feel like a lot of the things that we've done that have been most effective have been kind of, it's a new phrase in politics, or not new, but we've heard it a lot more uttered the past couple of weeks, sort of, you know, kitchen table issues, but they've definitely been issues very, very germane to our particular district. So I was just wondering, I mean, I know LV's been doing this for a while, and certainly, you know, Marty knows pretty much everything about CB6, I feel like, but what are some things that this committee historically have done that have really moved the needle as it pertains to our local district? I'm just curious about what some of those effective issues that we've championed have been. Does anybody have any kind of historic understanding of what those might have been?
I guess that's me, since I'm the longest term person on this committee and maybe on the board. No, Lou Sapersky outdates me by about 15 years. But the health committee had a strong connection to the hospitals in the area. And we would regularly have a presentation from someone from the hospital. We were also on the community advisement group of Bellevue, and there would be various issues within the hospital system that we had to side with one way or the other. When they were citing methadone clinics, besides the land use committee, they would come to us to, not only methadone, there was also some mental health organizations that were coming into the area. And we would give our 2 cents insofar as what kind of security we were looking for. We want sanitation in the street. Different things to keep the population of CB6 safer.
Yeah.
So those kinds of things, but even what Sandra was saying in regards to city employees now being faced with a backroom deal, it's something to look into, because there's a lot of city employees and retired city employees in our district. So it's it would be interesting to follow up on something like that. We even have a current city employee on this call too. Anyway, it's what any committee is what you make of it. I chaired 4 different committees. I never chaired this one, but and I gave up chairing committees when I was chair of the board. But the whatever you want to carry through, so long as there's a connection with the particular committee, and if it's for some other committee, you connect with the chair of that committee and see what you can do to get it on their agenda. We used to do mentoring. Do we still do mentoring, Jesus?
We're revamping that program right now.
Okay, because when I was chair, the day after the full board meeting, I would have a mentoring session with all new board members, and deconstructing what the resolutions that went through the night before were about, and who voted for what, why. 3 of the people who had been, or 2 of the people who had been in that group became board chairs. So it was a fairly successful committee, even though it gave more people more time that they had to participate. Anyway, sorry. Now I have to figure out how to put all that in minutes.
Any other question from the group?
I see Anju has her hand raised.
Yeah, Anju?
Actually, I just also wanted to, as a note to Dan's question, I think, Brendan, what you sent me on the community health profile, which I will now share with everyone in the chat, was a really helpful, at least starting point in understanding what some of like the gaps in healthcare or like health outcomes are for our community board specifically. And so just in terms of like generating ideas, it could also be a good starting point. We're evidently big binge drinkers. But yeah, just wanted to add that I think it's a good starting point to look at. I don't know how often these come out, but I think having the data like this helps us better understand how our neighborhood actually is faring in terms of health.
It usually comes every year.
We spoke to the health department about that. They haven't had one since 2018. I think it's a matter of funding. I think they're running up against funding problems to produce another one, because they do say it costs a lot of resources, because these community health profiles, they do one for each of the 59 community districts. So the first one they did was in 2015, and then they updated it with this in 2018, and we have not seen one since then.
Oh, wow.
We also had one in 2016.
Yeah. Well, then outside of like anecdotal experiences from those on our board, I guess it's difficult to understand like what some of those like real issues are without like having like data present in front of us. So yeah.
I see Marty has his hand raised.
Can we send this to the independent budget office and ask them if they can get all this information for us? It doesn't necessarily have to be as pretty as this, but that's their function is to give information.
I don't know whom you're addressing, but
You,
Oh,
because
we can-
it would come from the office.
we can see. We've never had to approach the independent budget office on anything in my time here, but we can see if there are specific data points that this committee really wants updated. We can see whether they have the capacity to give us the current numbers.
It would give a more up-to-date understanding of who our population is.
We could. Again, there's a lot of information in this report. So, it would be helpful if the committee maybe gave us an understanding of where they're going with this, so that we can better advocate for updating certain bits of information.
I'm gonna find out if we have the latest one in the Department of Health. And see also if we can, I'm gonna find out if we have the most recent statistics.
Because they're very nice reports. It would be nice if they came out every year, every 2 years or something like that.
Okay, so any other question? If not, we're gonna proceed to the next agenda. So our next agenda is the discussion on food products that contain dangerously high concentrations of THC that are deceptively packaged to look like standard snacks and candy. So I'm gonna share my screen. Okay, so this is just to give you updates on THC, which is also called Delta 8. So the alerts due to this Delta 8 THC. So on March 2021, West Virginia Poison Control Center reported 2 cases of adverse events with the use of the Delta 8 THC products in adults. So both individuals mistook the product that contains THC that gave rise to cannabis intoxication. And Another issue from Michigan Poison Control Center reports a severe adverse reactions in children who ingested a parent Delta 8 THC infused gummies purchased from a vape shop. On September 14, 2021, CDC Health Alert Network came out to alert the public, the health departments, health professionals, first responders, poison control centers, and laboratories on increased availability of the cannabis products containing Delta 8 tetrahydrocannabinol, in short THC, and the potential for adverse effects due to insufficient labeling of products containing this THC and cannabidiol. On October 27, 2021, the New York Attorney General Letitia James released a press issue warning the public about candy with dangerously high concentration of THC. And these chemicals are illegal in New York. So these are the samples of products that were deceptively designed to look like standard snacks and candy. Sour Patch Kids, Oreos, Cheeto Pops, Pebbles, and Doritos. Now, to give you more information about the Delta 8 THC, it's cannabinoids that exist naturally in the cannabis plant. It's a psychoactive chemical that can impair or alter the mind. It's marketed as weed light or diet weed. And it's available in vapes, smokable hemp sprayed with THC extract, available in distillates, tinctures, gummies, chocolates, and infused beverages. And they may also contain heavy metals, solvents, or pesticides. Now, the side effects of these, the adverse effects of this THC. The first one is lethargy, which is mainly lack of energy. It can give rise to uncoordinated movements, can give rise to slurred speech, which can manifest as poor pronunciation or mumbling. It can increase the heart rate initially, and then it slows down the heart rate. It can decrease blood pressure. It can cause difficulty of breathing. It can cause sedation, which is on a sleep-like state. And it can give rise to coma, which is prolonged unconsciousness. And also, just to remember that these THC does not have any antidote. Now, according to the New York Attorney General, since marijuana use has been legalized, accidental marijuana poisoning in children have increased, as well as visit to the emergency room or hospitalization. Now, the CDC recommendation for the public and consumer. Consumers should be aware of possible limitation in the labeling of products containing THC, even from approved marijuana and hemp retailers. Parents who consume edibles and other products that contain THC and CBD should store them safely from children. And because children may mistake the fruit-flavored gummies containing Delta 8 THC as candy. Now, the CDC recommendation for community-based organization like us is to raise awareness in their communities about the potential negative health effects associated with the use of the Delta-8 THC containing products. So now we can discuss how do we raise awareness in our community. Any suggestion?
I see that Marty's hand is raised.
Martin?
In another, well, during this next year or in a year, the dispensaries are going to start popping up throughout the neighborhoods. And there should be a requirement in any advertisements that they do that there's a of what the negative effects can be. And there probably should be some signage in the stores themselves in regards to protecting of children from them being able to get hold of the products.
Right, so, but what can we do as community board? What can we do to raise awareness within our community?
Well, again, we could pass a resolution that would then go to the city council members, and that would be a requirement, and that in effect would be a resolution, raise the awareness, because whenever anybody would be purchasing the products, they will be seeing these warning signs. It's how the federal government dealt with cigarettes. It took them 50 years, but.
Dan? Dan.
Yeah, thanks. I think that this is a really good topic to think about, especially because marijuana is now legal in obviously New York State. And I know, and I'd love to get sort of a better understanding holistically of how it's going to be rolled out, what that's going to look like in terms of the dispensaries, in terms of the laws, proximity to school, signage, community awareness, all of those things, I think from a very comprehensive standpoint, because this is obviously a major change in terms of how New York is going to be responding to this. And obviously there have been a number of states who have effectively, legalized marijuana and have had it in law for a long period of time. So, and people have studied it, they've studied the effects, they've studied kind of what has worked, what hasn't worked. So I'd love to this seems like a very interesting thing for us to sort of look at more holistically and get a better sense of how that is going to be implemented, because the sense that I get, which is again, very amateur, not having studied it comprehensively, is that a lot of these things obviously have been played out in other states. They've been worked through. And I feel like a lot of the people who were involved in, drafting the bills, passing the bills, voting for the bills, and then even implementing them, I don't think that they're as maybe comprehensively thoughtful about marijuana, its effects, the legalization, the black market, the marketing to children that other states frankly have dealt with. And not to get too far into the weeds here, but I mean, I do have, people who I'm close with who have basically been entrepreneurs in this area in other states that have been legalized. And through long conversations with them, it is absolutely fascinating to understand sort of the secondary and tertiary effects of this. And I just think that there are a ton of things that we can learn from those rollouts that I guarantee you have not been thought through by the people who have sponsored these bills, passed the bill. So I think that this is a great issue that we can step in front of and potentially be real leaders on within the community and perhaps even in the state.
Yeah, I agree with you. This is a big topic, and this takes a lot of thoughts and ideas and strategy to deal with this issue. But can we start with a more simple one just to make the community aware? What do you think about developing, can we develop a fact sheet or a flyer that would be simple for the community to understand that there are mislabeled products about this?
I mean, we could definitely do that. I mean, again, my sense around this is that, and I'd love to know much more comprehensively, but my sense around this is I understand, and I'd love to know exactly what kind of the legalization is going to be for edibles in New York State, because from my understanding, the other states have had basically, you can only buy very low milligram legal edibles. And generally speaking, parents are a little bit older, a little bit maybe more responsible in terms of their consumption. They're skewing more likely to buy legal edibles at dispensaries and therefore be kind of more circumspect around storage and keeping them away from children. So I think whatever we do would be important, but again, this is such a massive topic and I'm just so uneducated on it relative to the exact rollout that this, signage, information, whatever it may be, I think super important, but really getting a better sense of the 360 ecosystem. So for instance, I mean, maybe something, I'm just spitballing here, but in the future that we could do is it, to the extent that people are going to be consuming these and parents are, to try to create some type of, public campaign around maybe buying these through legal dispensaries. Because what has happened in other states is that when you legalize marijuana, the price of black market marijuana just goes to the floor. So, but obviously that's less regulated, therefore less safe. So yeah, I don't know. I'd love to really get a better sense of comprehensively the rollout, so then we can really be as most effective in our messaging to make sure that parents and really everybody in the community understands the potential adverse health effects of marijuana consumption.
Andrew?
Yeah, I have two thoughts mainly. One is going back to having an awareness campaign. My sense is that, as you're mentioning, that these are kind of disguised under the name of very common brands, that it's not disguised with the intent of fooling kids as much as it is with the intent of fooling law enforcement. So with that in mind, of a public campaign, what I'd imagine is taking a stab at it, that it's a way to more discreetly purchase edibles for kids in a way that it's harder for parents, harder for law enforcement, harder for adults to become aware of. So just something to keep in mind if we were to do something on public awareness. I'd imagine, if anything, similar to one of those juuling campaigns, anti-juuling campaigns, make sure your kids don't juul, make sure your kids don't take edibles. And that kind of gets into the larger question I had of, to Dan's point, I don't know too much about the marijuana legislation, really. Is there, what's legal? Are edibles legal? Is it just
Everything?
Everything's legal? Is it based on, is there an age minimum to purchase? Is it legal now, or is it only after a certain date?
It's 21. It's
21.
like alcohol.
Okay, okay.
And,
It is legal now.
and dispensaries are selling the products, and it's on, it's online. They deliver to your door. I haven't bought anything yet, but a chocolate thing looked interesting, and I may one day partake. We could do a forum. We could have somebody from the legal side, say from Godfrey's office or wherever I think it was, Liz's office was the one that was the center on that. And so she's our state senator. And, maybe invite somebody from Colorado who's been selling it for 10 years now, insofar as what their what has become of it within their history, and maybe a law enforcement person, somebody from the 13th or 17th precinct who could give an indication insofar as what effects that they have seen in our community. It's could be fun.
Brendan?
Yeah, I just wanted to flag the what I have written in the chat. I shared the legislation that was passed by both houses of the legislature and signed by Governor Cuomo, then Governor Cuomo, earlier this year. The Marijuana Regulation and Taxation Act. That legislation might answer certain questions committee members have about how this will be implemented. It may also prompt additional questions. But committee members may be interested in looking at that piece of legislation. I can even email the link that I shared in the chat to committee members tomorrow or in the next few days. Senator Krueger was indeed the Senate sponsor, the primary sponsor of this bill. So Marty was correct about that. And I also see Jesus has his hand raised.
Jesus has. Yeah.
Thank you. So I have maybe some suggestions about this. One possibility is that the community board, this committee rather, can design its own flyer, for example, on this. I, however, have some misgivings about that because apart from LV, I'm not sure anyone else on the committee really has the medical training to really be able to put themselves behind something like that. I think if the flyer or a fact sheet or something that can be easily distributed to parents or in schools or in shops or things like that, I think something like that would be better. It would be better to come from the health department. If you guys remember a few years back when K2 synthetic cannabinoids really became something that was in the news a lot and was something that was dealt with at many city agency and elected official offices, the Department of Health put out flyers for warning people against K2 and synthetic cannabinoids. Maybe this committee could pass a resolution asking the Department of Health to create a flyer or information campaign on this particular topic. They obviously, as LB can attest, because she works at the Department of Health, they have the background and the expertise and the teams that have the expertise that could put something together. And they've done information campaigns before, so maybe they have, so I would imagine they have the knowledge and expertise required to pull one off like this. That said, I would also say that if this committee is interested in this topic, that it would be good to perhaps learn a little bit more about sort of conditions on the ground, like, have the committee members visited perhaps vape shops in the district, and just kind of to look around to see if these products are there. Have we conferred with the education committee to see whether schools have heard they're seeing their kids with these things? Have those who are well versed with PTA groups or with church groups or something, have they heard in the district that this is something that they've seen kids with? It might be good before a resolution is drafted saying to the health department, hey, craft an information campaign about this particular topic. It probably would be good for the committee to be able to say, oh, okay, we've been investigating a little bit in our own community, and we see that these products are in these stores, or we see that we see that students in our schools are becoming more exposed to them. You have some sort of sense of what things are like on the ground. We might even be able to reach out to the hospitals in our district, NYU, Bellevue, Mount Sinai. Maybe they would be able to tell us whether they've seen an uptick in visits that relate to this particular type of product. It would be, before we start asking agencies, as we are a city agency, and the community board is a small, but it is still a city agency. Before we start going and asking other city agencies to sort of expend their resources and their time and their effort to do this, I think it would be good for this committee to show that it has done the work on the ground and can say, this is what it's like in this district. We think, based upon this, that there should be an information campaign.
I put in the chat what the DOH has on marijuana.
Yeah, I think
It's fairly comprehensive.
Well, maybe they already have something.
Yeah.
Yeah, but it's not necessarily a warning. It tells the whole story. It's both the pluses and minuses. And I don't believe that we necessarily want that, but if we could ask them to trim it to be more of a fact sheet insofar as the effects for children.
Yeah, I'll look into that. That's what actually I would like to do, to develop a fact sheet that is more simple for the community. Because we may have a fact sheet that is too technical, but we can develop a simple one that is more for the public or the community. So I will look into that. I think Sandra has a question.
Yeah, that was a comment. Well, it's a question too. And again, partly it's procedural in terms of how the community board works, and in a sense relative to other communities, because this is obviously, it's not a problem in this neighborhood, it's a problem in cities, will be ultimately a problem in the city. And so the approach of a particular local community board, I understand it starts someplace, but certainly the collaboration with other boards working on health issues would seem very reasonable, so that you're not reinventing the wheel across other communities, and you're developing something that's meaningful in a larger context. So again, I don't know quite how this works, but certainly you're raising an issue that goes beyond this community. You've got students coming in from all over the city to our high schools, right, in this community. So do you work in collaboration? It would seem, I could see the pluses of that, but again, I don't know how that works across community boards.
We've asked other community boards in the past for examples of what they were doing on a particular topic. At times, we've just endorsed a resolution from another community board, especially those that border us, such as Board 8 in the north and Board 5 and Board 3, based on a resolution that they prepared that really spoke to the facts of what we wanted to say as well. But but in getting information, like for instance, one of the bylaws revision committees that I chaired, we had gotten the bylaws from the other 11 community boards in the city to look over to see what's the best parts of them. Not all, by the way, not all community boards have a health committee. Every
Yeah.
community board has different committees of different names, many of which we have, our committees do similar kind of work, but not necessarily the same names. We could ask if they're doing anything with this. But we've over the years, we've tended to take the lead in many things. And other community boards and the rest of the city often followed our lead. We were very proactive
Interesting.
for many years, and not necessarily reactive to by endorsing some other legislation. We developed legislation.
How does another community board know what you're doing? What's the, the information flow? How does that work?
Once a month, the chair has a meeting with the other community boards at the borough president's office.
Okay.
It's called the Borough Board. And a lot of information is passed back and forth.
Okay, thank you. That's very helpful to get an idea of how this all comes together. I appreciate that. Thank you.
Okay, any other suggestion? No other suggestion, no other comments? Okay, so we will now proceed to, is that right, Jesus? We will now proceed to the chair's report.
Yes.
If you're finished with this topic, if you've said everything you want to say, you can proceed. It might be good to have some next steps, or if you want to take this information and sort of think about it a little bit, and then maybe come with next steps for next month. That's also fine. But if you're done for tonight, then you can move on to the chair's report. Yes.
Yeah, Alvi said she'd look into getting the a fact sheet going. So let's move on. Move the agenda.
Probably some of us can look into some of the other suggestions that we have, like probably knowing more information about these at the legal office or at the law enforcement office if they do. So probably some of us can take some of these suggestion, and we can discuss again in our next meeting.
We may be able to get somebody from Liz's office to explain it.
Yeah.
Maybe even Liz. She's great at explaining things.
Okay. And I'll look into the fact sheet if we do have in the Department of Home. I'll look into that.
Jesus, will you contact Liz's office to see if we can get a speaker?
We can, but again, is it on the marijuana legislation?
On the bill, on the new law?
About this particular, because what LV lectured on today is a very particular topic
Right,
about,
that's different.
you know, we can. You know, it might also be good for the committee members to do a little bit of reading on their own. It never hurts to do a little bit of homework, and so that one can have be prepared to have questions to ask. We don't need folks to explain everything, but yes, we can reach out to Liz's office to
Maybe for the January meeting, because the December meeting, we're going to learn about the new health law, I hope.
yes, well, we'll discuss this with Anju and LV as setting the agendas will be their responsibility.
Great.
And then we'll sort out scheduling for speakers at that time.
Okay, so we will now proceed to the next one. I don't really have any report, except I would like to make an announcement that the series of the Healthy Living series presentation will now be quarterly. So our next one will be in January. So instead of monthly, it's going to be quarterly. And also, I just would like for everyone to know that Anju Suresh is our new vice chair of this committee. Okay, so let's welcome Anju. And Anju will be mainly responsible for coordinating topics for this committee, agenda topics.
Terrific, congratulations. It's always good to see people people taking more responsibility.
Oh, thank you. Yeah, and I appreciate having all of the expertise on this board as well. As I navigate this with LV.
Yeah, thank you, Andrew. Okay, so any other new business? No other new business? If there's no objection, we will adjourn the meeting.
So moved.
Okay, so seeing no further business, the meeting is adjourned at 7:40 p.m. And thank you so much, everyone.